Hello everyone. Today we have operated a case of L4-L5 disc herniation with Cauda equina syndrome. Cauda equina syndrome is a condition in which a disc compresses the nerves in the lumbar spinal canal so much that there is loss of bowel bladder control. This patient was suffering from bilateral leg pain and difficulty in passing urine for the past 3 months. He did not know whom to consult and he was clueless about his condition. He was catheterized for the past 3 months and he was not able to pass urine without a pipe. He came to us 3 days back and we did an MRI which showed a large L4 L5 disc herniation. You can see here, this is the L4 and this is the L5. Between these two vertebrae is a disc. This disc has come out and it has closed the entire L4 L5 canal. You can see here the black spot which is there. This disc which has slipped out from the L4 L5 disc has compressed the entire spinal canal. Because of this, there is bilateral leg pain and weakness, and the patient is not able to pass urine on his own. Because of this large disc herniation, the space between two vertebrae, the L4 and the L5, has reduced. You can see that the disc space at L3 L4 is substantial, but at L4 L5 the disc space has reduced. This is because the disc between the L4 and L5 vertebra has slipped out and it has come in the spinal canal. So because of this large disc herniation, we had to put screws in the spine to stabilize the motion segment. This also prevents the risk of reherniation in the future. So we have done unilateral TLIF, which means transforaminal lumbar interbody fusion, in which we remove the entire disc between the L4 and L5 vertebrae and fill it with bone graft. Also, we fix the motion segment with titanium screws, which allows better healing and solid fusion between L4 and L5 vertebrae. So we have performed this surgery via a paramedian incision. Traditionally, we make a midline cut in the back, but in this modified technique, we take a 3 centimeter incision from the paramedian approach. That is, we make an incision off from the midline. This helps us in putting the screw with a better medial trajectory. You can see here that the incision length is less than 3 centimeter and the approach is paramedian, and with little muscle tissue and muscle damage, we are able to put screws, we are able to remove the disc, and we are able to decompress the spinal canal. So gone are the days when we used to require 10-12 centimeter long incisions for a disc herniation surgery. In this age of better illumination, magnification, with added benefit and advantage of navigation technology, we are able to do these kind of surgery with an incision as small as 3 centimeter. You can see there is no blood loss coming from the wound. The wound is absolutely dry and the incision length is roughly 3 centimeter. Because this approach doesn't allow excessive muscle cutting and stripping, there is limited post-operative pain and the patient is able to walk within 8 hours of surgery and gets discharged within 48 hours of surgery. And there is no long-term restriction in daily activities advised by us. So the patient can start walking, sitting in a sofa, patient can go to washroom on his own. There is no restriction whatsoever in the post-operative period and the patients can go back to normal life within a span of 1 to 2 weeks. Thank you.